we are discussing about transmissible venereal tumor, that is TVT. So it is a round cell tumor. Round cell tumor. So basic identification. So how we identify this tumor is, so simply you find a round cell, round nuclei, and you see vacuoles, white vacuoles. So what are the clinical, what is the cause of this tumor? That is unknown till now. So cause of this tumor is unknown till now. How it gets transmitted? It gets sexually transmitted. Sexually transmitted. So we call it as sticker cell tumor. Sticker cell tumor. So basically this tumor has a typical characteristic of cells, that these cells stick to any tissue. That's why we call sticker cell tumor. So clinical findings of this tumor. What are the clinical findings of this tumor? That is vaginal bleeding. Vaginal bleeding. So main clinical sign is vaginal bleeding, and you sometime hear about the history, that there is history of mating with stray dog or some other affected dog which has penile bleeding, which has bleeding from penile area. So that kind of history is there in this tumor. So if we talk about diagnosis, so diagnosis is very important. Until and unless you confirm this tumor, you should not start treatment, because as you already know, because there are chemotherapeutic agents which have adverse effect on the animal body. So you diagnose basically on this cytology. You take impression smear. If growth is palpable or identified, you simply take impression from that and make impression smear and stain with Leishman or any other stain and see under microscope. This is one way. Second way, that is FNAC. So sometimes tumor is not clinically apparent. So sometimes, like in my hospital, one case came that is not typical of TVT. So TVT, if clinically it appears like cauliflower-like growth. But one case presented to my hospital that doesn't have appearance like that, cauliflower. So we take FNAC, and after FNAC we confirm this tumor is TVT. So again, we on a microscopic view, we simply see a nucleus which is bluish in color, and we see the pinkish cytoplasm, and we see the vacuoles. So this is a typical feature of TVT tumor. So what about the treatment? If we talk about treatment is we inject vincristine. So vincristine at the dose rate of 0.025 mg per kg body weight. Sometimes TVT doesn't respond to this drug, so we can use doxorubicin. So these drugs have very adverse effects. So sometimes these drugs can kill the animal. So use very cautiously. Right? So this drug has adverse effect, like it will cause paralytic ileus. So we should add some laxatives, because vincristine causes constipation. Thank you.